Howdy, my name is Anna, and I am here to talk to you today about managing your hypertension or high blood pressure. According to the World Heart Federation, hypertension or high blood pressure is the #1 risk factor for death globally. In fact, the CDC states that only 1 in 4 individuals who have been diagnosed with hypertension actually manage their disease. I am here today to encourage you to take control of your disease by either simply making a lifestyle change or taking the medications that can be prescribed by your doctor. Because by not managing this disease, it can lead to cardiac failure, stroke, and sudden cardiac death. Knowing that hypertension is so prevalent in our world today and that not very many individuals manage their disease, the first step that you can take is by simply making a lifestyle change. One of these changes is reducing your sodium intake. Sodium is a very prevalent ion in your cardio system, and by reducing it, you overall reduce your blood pressure. Another way you can reduce your blood pressure is by lowering your stress. Now, I know it's hard to lower stress on the daily, but there is a system in your body that is directly related to your cardiac output, or how hard your heart contracts and the overall rate of your heart. And this is your sympathetic nervous system, which is also known as your fight or flight system. And when you are super stressed, you stimulate your sympathetic nervous system, which increases your heart rate and increases the strength of contraction of your heart, which leads to high blood pressure. So by reducing your stress, you reduce the amount of stimulation and reduce the blood pressure. Stress is also known to lead to a poor diet and alcohol consumption, which are both factors that can overall increase your blood pressure. The final step that you can take to reduce your blood pressure is to simply stay active. Your heart is a muscle, just like your biceps or your quads or any other muscle that you go to work out in the gym. So when you do your cardio, you are working out the muscle of your heart, and it leads to your heart being more efficient, which lowers your blood pressure. Now, for some individuals, making a lifestyle change isn't as simple as that. So medications can be prescribed by your general practitioner or a cardiologist. These medications are these are the top 2 that I've found. A beta blocker is a very popular medication that is prescribed, and your heart has a beta-1 receptor, which is found directly on your heart, and it is in control of how hard your heart contracts, like the strength of the contraction, and the overall rate of your heart. So a beta blocker essentially blocks that receptor on your heart and reduces the stimulation that is controlled by that receptor. So it overall reduces your blood pressure. The second type is a vasodilator. I like to think of this as your blood vessels as kind of like the circle, right? So if it's super contracted, there's not much of a diameter and there's a lot of resistance. So your heart has to contract a lot harder to get that blood to flow through it. With a vasodilator, it increases the diameter of your blood vessel so the blood can flow much more freely through your blood vessels, and your heart does not have to contract quite as hard. Finally, I just want to bring attention to, if you do not manage this disease with those 2 ways, then it is a very serious outcome. Untreated hypertension can lead to heart failure, stroke, and sudden cardiac death. The heart failure is brought on because when your heart is having to contract super hard, the overall amount of blood that it has to push out with each contraction increases. And so the part of your heart that fills with the blood before it contracts actually stretches, and you see your heart actually grows in size. And with this growth, the walls of your heart start to thin, and over time they can just give out, which leads to the sudden cardiac death and stroke. As for stroke, according to a study done by Borhat and Tackling, half of the strokes documented were a result of hypertension. And this is because when your heart is having that high blood pressure and contracting super hard, it disrupts the normal flow of your blood, and this can lead to blood clots being formed. And because there's no barrier between your cranium and the rest of your body for the blood clots are sent straight to your brain, and this can cause either death or extreme deficits. So my call to action to you is, if you know that hypertension and high blood pressure run in your family, I would encourage you to contact your general practitioner and make sure that this isn't something that you need to be aware of now. And I also encourage you, if you know of an individual who has a high blood pressure diagnosis, encourage them to take control of their disease, because it can lead to death and cardiac failure and stroke, and it can simply be managed by making a lifestyle change or taking the proper medication. These are my references, and thank you so much for your time.